Cervical spondylosis refers to a series of syndromes around the cervical vertebrae, such as spondylosis and aching pain on the neck, shoulder, and back, numbness of fingers, headache, dizziness, and vomiting. The symptoms may be alleviated or aggravated by moving the neck. Stiff neck only refers to muscular spasms of the neck. It is an acute simple syndrome of neck muscular stiff and pain. Holographic meridian scraping therapy can help dredge the meridians of the neck and shoulder, dispel harmful factors in the meridians, and elevate pain and limitation of motion. Scraping has the effect of diagnosis and prevention. The miliary cutaneous bleeding indicates the location of cervical spondylosis. Stiff neck has mute symptoms in the early stage. Timely treatment can help prevent stiff neck. This patient has suffered from cervical spondylosis for 10 years. In recent years, she has stiff and painful neck, arm numbness, and feels dizziness as moving the neck. Now let's give treatment to the patient. First, introduce holographic regions on the head. GV20 point is at the middle point of the line connecting the apexes of the bilateral ears. The upper one-third of vertex occiput region is under GV20. Scrap both regions with rigorous scraping, then scrap the posterior oblique region of vertex temporal bilateral to GV20. The third metacarpal bone on the dorsum of hand corresponds to the vertebrae, and the root of the middle finger corresponds to hind head and cervical vertebrae. Smear lubricator first. Appearance of miliary cutaneous bleeding indicates qi blood supplying disturbance of the head caused by cervical spondylosis. Now let's introduce acupoints for the treatment.
风府、风池、天柱、大柱、肩颈、深柱、天宗、曲池、外关、中柱、阳陵泉、悬中。后颈部
Apply lubricator to the posterior part of the neck. Scrap from the upper to the lower with board scraping. Beginning from the hairline for dizziness, the wrist force should be applied from lightly to heavily with the plate at an angle of 45 degrees.
按压的力度从小逐渐加大。
Attention should be paid to a case of a spinal cervical spondylosis, and the posterior part of the neck should be pressed gently. After several scrapings, miliary cutaneous bleeding appears at pathological region. The part with pain and much cutaneous bleeding is the pathological vertebra. Here is G20 point in the depressions. Scrap from G20 to root of the neck using the corner of plate. Then, with G21 point as the center, scrap from the inside to the outside. And G21 should be pressed heavily. Then scrap G20 to G21 on the contralateral. Scrap B10 to B11 bilateral to the cervical vertebra from the upper to the lower. Then scrap the acupoints bilateral to the cervical vertebra with the corner of plate, which needs oblique slightly.
脊柱是骨骼凸起的部位，两侧的膀胱经处于洼陷部位，所以刮拭的时候，脚部稍稍倾斜，这样正好刮在经脉之处。
Here is SI11 point. An appearance of subcutaneous node indicates meridian severe staxis here. After scraping all points on the back, the lubricator should be cleared up, while the points are kneaded gently. Now scrap LI11 and TE5 points on the arm from the upper to the lower, supporting patient's arm on the other hand. Knead TE3 point with plate corner while let patient move the neck. As the patient has numbness at the arm, we can apply scraping lubricator on the inside of the elbow joint, then tap the points on this part. During tapping, one hand supports the patient's arm and the other hand tapes from the upper to the lower and from lightly to heavily. And at the same time, let the patient's arm relax. The patient should have a rest between two tappings. Deep cutaneous bleeding appears gradually after several tappings. Purplish black bleeding indicates serious stasis in the meridian. Here is G34 point, where must be scraped downward to G39 for patients having cervical spondylosis for a long time. Now let's scrap the second metacarpal bone. Here is foot point, and here is head point. Cervical vertebra point is under the head point. Knead cervical vertebra point with plate edge and apply the emphasis on the painful point for 1 or 2 minutes. Then smear the lubricator on the part and scrap from the upper to the lower. The patient's cervical vertebra point on the third metacarpal bone, ear and inside of big toe can usually be scrapped. Treating parts for stiff neck are the same as for cervical vertebra, and the difference is to apply emphasis on painful point of the neck and shoulder, to scrap bladder meridian on the back longer and SI3 point, and to knead Lauzon point for stiff neck. Holographic meridian scraping therapy can help rapidly dredge meridian and remit pain. Now the patient can move her head freely without feeling headache or dizziness.